So it's summertime, and summertime means travel. Hopefully, many of you are taking vacations, taking a holiday that might require you to be in the car for an extended period of time, airplanes, hopefully, different things like that. So when we travel, obviously, we're exposed to different environments. You know, typically when we're at our work environment, we've talked about that in the past, of being set up correctly ergonomically, at home with our bed, office chairs, those types of things. It gets a little tricky when we're traveling. So airplanes, cars, hotels, those three things can create some challenges. So I have a few quick tips for you to hopefully prevent neck, low back pain. If you unfortunately do suffer from one of those things, hopefully this could manage those symptoms as well, those conditions. So number one, if you're driving, okay, obviously if we're driving for an extended period of time, take some breaks. You know, just like we've talked about sitting at our chair, we want to break that trip up. And ideally, I would want you pulling over every 45 minutes to an hour, just to give yourself a break. Get out of the car, unload your back a little bit. Obviously, just like when I'm sitting at my desk chair, the longer I'm sitting, gravity's working against me. Put a lot of stress and pressure on those discs and our low back and the joints. So we just want to get out of the car and move around. Secondly, let's focus on lumbar supports, ergonomics in the car. You know, with technology and a lot of the newer automobiles, most of them have some type of a lumbar support. You know, before you get on the road, get in that vehicle, try to get your knees to a comfortable position, back up against the backrest, head relatively neutral between your shoulders, and allow that lumbar support to do its work. We want that curve to kind of sit in the small of your back to maintain that lumbar curve, if you will, and that will hopefully reduce some of the pressure on those joints as well. So driving, let's pull over as much as we can, get out, walk around just for a few minutes, unload, and then get up, set up properly in our car with our lumbar support. Well, the airplane creates a challenge because many of you know there's not a lumbar support in the airplane. So if you can find some form of little small pillow that you could travel with. Here in the clinic, we use these little inflatable beach balls, which are really versatile. But the great thing about these small beach balls is that you can adapt or change the amount of air that's in the ball. So some people need a little more support in their lumbar spine, put a little more air in the ball. Others don't need as much. And so what you want to do with that pillow or that beach ball is just get that thing right underneath the small of your back, okay? We want to maintain that lumbar curve right there in the small of your back. So, you know, just as in the car, the airplane, we want to really focus on lumbar support, shoulders back, head in a relatively neutral position. If you have an opportunity, long flight, maybe get up and move around a little bit as well. Hotels, you know, many of us are creatures of habit. We really kind of gotten used to our sleeping environment. We've talked about it in the past. You know, the mattress is so very important. Hopefully we've done our research. We have a good mattress at home, provides a fair amount of support, very firm. Well, when we travel, unfortunately, in hotels, you can't really pick your mattress. And, you know, my experience has shown me that, you know, these hotel mattresses, yet they're very comfortable. They're super soft. And as they're super soft, they're not going to give us much support. So here we're stuck. You know, there's not a whole lot that we can be doing to change our hotel beds. You know, I would recommend that you obviously sleep on your side or your back. If you have the capacity to travel with your own pillow, that might help as well to keep you relatively neutral. You know, we've talked about neutral cervical spine when you sleep. We want your neck in line with the rest of your body. We don't want you laterally flexed to one side or the other. That could be a good option for you. So side sleeping, back sleeping, always good. And then utilize your own pillow if possible. And then take a few minutes to get up and move around, you know, in the morning. We've talked about that the morning time is kind of that danger zone. Many accidents, injuries occur. We're not warmed up properly. We bend to put our shoes and socks on. So hopefully you're doing some of our exercises that we've sent, you know, potentially at Tulsa Spine and Rehab. We'd like to send those exercises out. You know, if you have a routine that you do, let's carry on with that routine there in the hotel. Get up a few minutes early. Let's work on those exercises to get you warmed up. And then lastly, we want to enjoy ourselves on vacation. We don't want neck and low back pain to interfere with what we're doing. So move. Exercise, have a good time, utilize this vacation and get out and walk, enjoy the outside. I mean, it's kind of a unique time right now. A lot of us are just bottled up inside. Get outside and walk and exercise. You know, if you're in the mountains, get up and hike. If you're on the beach, get out on the beach and move. So that's really, really important to kind of maintain some of that normal activity day to day. So if you're in your car, let's focus on the lumbar support, get out and move around periodically, try to break that trip up a little bit. Airplanes, let's get some form of lumbar support, beach ball or a pillow. That hotel, let's focus on the sleeping position on your side or your back. Keep that nose in line with the rest of your spine. And then in my opinion, most importantly, keep moving. Let's exercising and don't forget to enjoy yourself.